Time for Miracles with Midge, and there's our song, Let's Talk About Sex. I wonder where I'm playing that. Well, I have my guest, Heather Simonson, and Heather and I met about a year ago, or maybe more, right Heather?
It's been a while, actually.
Yeah, we met doing mindfulness education together. But Heather is a whole bunch of awesome stuff, but she is a sex therapist, right, and among other things, and I just need to ask you, first of all, when people hear that you're a sex therapist, what do they ask you? Like, they're curious of what that means. What was your feeling of what they ask you?
There are a lot of misconceptions about what sex therapists do, actually. And, you know, to be really clear, we basically, it kind of goes along with what you all were talking about in terms of the Cowgirls song earlier, in terms of keeping people's passions alive. And that's really what we try to do, is that we look at what's going on, and of course we address any type of sexual dysfunctions that are happening, but we really want people to just have a happy, healthy, pleasurable, you know, mutual, respectful relationship and sex life. And that's what we try to help support people through.
Right, so that's about intimacy and partners, but you also do a lot more than just partner therapy, correct?
Yeah, I work with individuals, women, kids when, you know, when it's appropriate. So I also do sex education in the schools. So a lot of different venues and ways that we try to educate people and support them.
Right. Well, Steve and I were having a discussion earlier about Planned Parenthood, and basically we were wondering what your thoughts are, because we kind of had different views about this, where they give, you know, teenage boys condoms and things like that to have safe sex. Now, some people think that's like telling them it's okay to have sex at a young age, and they don't really agree that that's a good thing. But other people feel that it's a good thing because they might be doing it anyway, and then they'll be safe. So what is your view on that?
It's a really good question and a very common fear that people have. I hear it all the time. I used to be the director of education at Planned Parenthood, and we would give condoms to both girls and boys. So not just the boys, because the girls know how to keep themselves protected also. And we hear that all the time. Just, you know, if we're teaching them about being safe, does that mean that it's going to make them do it? Well, if we can all think back to when we were younger, if someone put a condom in our hand, does that mean that we're going to go out and have sex?
Yeah, no, right. It just depends on the person.
No, of course not, right? It's the same thing with when we need to talk to our kids about, you know, being safe in social situations and going to parties, or with alcohol or drugs or whatever it is. It's not just about the sex. It's about, you know, empowering our kids, our youth, with the information that they need to make empowered, informed decisions for themselves.
That was a perfect segue to what I was going to ask you next. Basically, I was wondering, do you give parents the tools to talk to their children? Like, if they came to you, would they come to you and say, how do I talk to my child about sex? Because sometimes it's not so easy.
Yeah, in fact, I have a wonderful program called Pep Talks, Parent Empowerment Project. That's geared just toward the parents to help them learn conversation starters and tools and statistics and all the information that they need for them to feel empowered to talk to their kids. Because as you know, as much as some schools will provide some education around how to be safe, the only people that can give kids their values is their parents. And so really parents are the primary sexuality educators of their children, and that's where it should be coming from.
Right, and at what age would you recommend that parents start speaking to their children about sex?
Well, that's you really ask very good questions.
I try.
You do.
I just kidding.
And they're all the right ones, because these are the most common questions that people ask. And if we're talking about sex per se, then it needs to be age appropriate, right? So if you're talking about 10-year-olds or 9-year-olds, then we need to be talking with them about their bodies and how they're changing, and puberty and all of that stuff, and why their bodies are going through puberty, and that it means that they are, you know, one day able to have a child. That that's what the reason that their bodies are going through those changes. If we're talking about, let's say, 15, 16-year-olds, then we need to be talking to them about being safe, and what does it mean to be in a sexual relationship, and how do you keep yourself protected, and how do you stay in a happy relationship, right? Because people don't talk to us about that kind of thing either, right? Really, the core question, I think, is when do we talk to our kids about sexuality, not necessarily sex, because sexuality is something that starts from the minute that we're born, and it starts from when we start talking to our children and bathing them and teaching them about the proper names for their body parts. That's when they start getting those messages, because even from very, very little, if we're using funny nicknames and, like if you could think of the kinds of nicknames that you've learned down the line or have heard.
I'm laughing because I used to say to my son, like pee-pee tail.
That's it, right? So
you're suggesting not to do that?
I'm suggesting not to do that.
Okay.
Yeah.
So all the correct words for as children as young as when they're born.
When they're born. When they're born, and we start, and we're bathing them and we're teaching them their body parts and everything. And if you think about why that's important, just think about if we're using the pee-pee or the down there or whatever, what message does that send to our kids about
that you can't even talk about it.
Exactly.
Wow,
right?
good point.
That you can't
I didn't
talk
think of that till you just said it.
That it sends a message of feeling shameful or guilty or embarrassed, or that it's funny, and those aren't the messages we want for ourselves to have about our own bodies, and they're not the messages we really want for our kids to have.
Right. Well, and I also was intrigued by something else that I noticed that you do about mood disorders for people who have maybe postpartum or things like that. So you do help those women who have postpartum depression.
Yeah, as a matter of fact, in my yoga world, because I'm also a yoga teacher, I specialize in prenatal yoga, and with all my experience with working in women's health and reproductive rights and Planned Parenthood, I've definitely, in terms of the counseling path, have tried to make that part of my purview. So
it's really important. And I think so many people go through it, but they're embarrassed to say. And that could be really harming, for a child or anybody else and themselves.
And their families, their partners, and a lot of people think that it's just a form of depression, and it's really perinatal mood disorder, which has, it really manifests itself in different ways. So anxiety, depression, sometimes psychosis even.
So is there a way to get through postpartum depression without seeking therapy normally, or is it just better off that they seek therapy and it'll go along quicker to get them through it?